Okay, again, for the record, good morning, guys. This is the class Pharmacology for medical assisting or Pharmacology for all the careers that are here in the class. This is Unit 18, Vitamins, Minerals, and Herbals. We already talked about the first part that is about nutrition. All this information we already checked. Let's review a little bit of this, and let's go more in detail the part that is about vitamins, minerals, and herbal, medicinal herbals. 4 of 10 leading causes of death are directly related to poor diet, poor eating habits beginning childhood. Diabetes has risen to an epidemic level. Obesity is when you have a BMI higher than 30, a body mass index that is calculated with your height and weight. We talked about this already, dietary guidelines for Americans, some recommendations. These recommendations are mostly recommending eating a variety of vegetables and proteins, control calorie intake, increase fruit, vegetables, and whole grains, reduce fat and cholesterol, use low fat or non fat dairy products, limit sugar and salt, consume less than 10% of calories a day from sugar saturated fats. We talked about My Plate already. That is the website from the government. The website and the project that is kind of a guidance for nutrition for the community. My Plate and the 5 basic food groups. This information is very helpful. The USDA new food icon is this. And this emphasizes again the consuming of fruit, vegetable, grains, protein foods, and dairy groups. Make half your plate fruits and vegetables. Make half your grains whole grains. Move to low fat and fat free dairy. Vary protein routine. Eat and drink the right amount. The 5 basic food groups are these 5. Number 1, grains, 3 or more ounce equivalents a day is good to intake. Fruits, any fruit or 100% fruit juice. Vegetables, sufficient amount while staying within energy needs. Dairy, 3 cups a day of fat-free or low-fat milk or equivalent milk product. And protein, 2 to 3 servings a day. Vitamins, you have vitamins that are fat soluble and are stored in the adipose tissue and liver. The vitamins, fat soluble, are A, D, E, and K. And you have water soluble vitamins that are not stored in the body, must be replaced daily. For example, the vitamins C and B vitamins. Vitamins are organic substances that are essential for normal metabolism, growth, and development of the human body. They are complex chemical substances that may be obtained naturally from plants, animals, and sunshine, or they may be made commercially. Vitamins may be classified as fat soluble and water soluble. The fat soluble vitamins are vitamin A, D, E, and K. The water soluble vitamins
They putting this shit together because then they're gonna be like, oh shit.
B2, niacin, nicotine, that is nicotine acid, pyridoxine, that is the B6, folic acid, cyanocobalamin B12, biotin, and C, that is ascorbic acid. The fat soluble vitamins are stored in adipose tissue and the liver, this group here. And the water soluble vitamins are not stored in the body. They are essential to health and need to be replaced on a daily basis. The US RDA for each vitamin is given in the book When an individual follows these recommendation allowances, conditions such as avitaminosis, hypovitaminosis, or hypervitaminosis can be prevented. Some of the commonly prescribed vitamins products are Teragram, Centrum, Citracal, BCV, Teravid, Vicon C, Vicon Forte, Vita Plus H, Nico 400, Oscal Forte, Cyanocobalamin, vitamin B12, Redisol, Rubramine, folic acid, Folbite, folinic acid, leucovorin, and vitamin K, aquamepitone. Now let's talk about minerals.
Oh my, she said, let her black ass go and move. Oh my God, Carlene. It's not nice.
Professor, do you have me for attendance?
Shania Matthew.
Yes.
Let me double check. Shania Matthew. I need to put you present. Give me one sec. So continuing with minerals. Minerals are the body's weight. First is 60 to 70% water. Hemostasis is presented when normal fluid state in which positive cation and negative ions are in balance. Electrolytes like sodium, potassium, calcium, magnesium, chloride, carbonate, phosphorus, sulfate, all these are necessary for the homeostasis. Minerals in general are non-organic substances that are essential constituents of all body cells. Minerals play an important role in maintaining the water balance of the body. Let's start with electrolytes. The body's weight is 60 to 70% water. All cells are bathed by an aqueous solution that brings nourishment to the cells and remove waste. Shamika, right?
No, not me. It was somebody else's attendance you were supposed to fix.
No, it's Shania Matthew.
Shania, sorry. Shania Matthew. Right here. All right, Shania.
Can you fix mine too, Professor? Alaskia Mac?
What's your name?
Mac Alaskia.
Right here, Alaska Mac. All right. So,
Thank you.
always. All cells are bathed by an aqueous solution that brings nourishment to the cells and remove waste. Electrolytes, acid, bases, and salts are suspended in this solution. Electrolytes are particles that result from disintegration of compounds. They are found dissolved in the body fluids as ions that carry electrical charges. A cation is an ion with a positive charge of electricity. An ion is an ion with a negative charge of electricity. Cations and ions are involved in metabolic activities and are essential to the normal function of all cells. The normal fluid state in which positive and negative ions are in balance is called homeostasis. The chief cations and ions are sodium, potassium, calcium, and magnesium, and these are the cations. The cations are sodium, potassium, calcium, and magnesium. These are positive. And the anions that are negative are chloride, carbonate, phosphate, and sulfate. Selected minerals and their functions, food sources, RDAs, indications of deficiency, and toxicity are described in the book. Minerals are excreted daily from the body, therefore, it is most important to replace them through a well-balanced diet. Minerals may be grouped as macrominerals and microminerals. Macrominerals are the minerals that are required in large amounts. This group includes calcium, phosphorus, magnesium, sodium, potassium chloride, and sulfur. Microminerals are minerals that are required in small amounts. They are also known as trace elements. This group includes iron, copper, iodine, manganese, zinc, fluoride, cobalt, chromium, tin, selenium, vanadium, silicon, nickel, and molybdenum. Well, before going to herbal, medicinal herbals and supplements, let's take a look to the vitamins and their function and food sources and the indication of deficiency and hypervitaminosis. What causes hypervitaminosis of them? So let's talk about each one of the vitamins one by one to describe their function and all the details about them. For example, vitamin A. Vitamin A is important to healthy mucous membranes, skin epithelial cells, development of bones and teeth, and for vision in dim light. Food sources of vitamin A are dairy products, fish, liver oils, animal liver, and green and yellow vegetables. Indications of deficiency. If there is a deficiency of vitamin A, you can have a patient with retarded growth, susceptibility to disease, skin lesions, and night blindness. If you have an excess of vitamin A, you will have anorexia, loss of hair, pain in long bones, fragility of bones, dry skin, pruritus, and enlarged liver and spleen. Now let's talk about vitamin D. Vitamin D aids in the proper use of calcium and phosphorus in the body. Food sources of vitamin D: ultraviolet rays, dairy products and commercial foods that contain supplemental vitamin D like milk and cereals, and fish and liver oils. Indications of deficiency of vitamin D: in childhood for rickets, and in adults for osteomalacia, muscle spasm, and spontaneous fractures. Hypervitaminosis of vitamin D and excess of vitamin D can cause demineralization or softening of bone, hypercalcemia, calcium deposits in soft tissue, hypertension, diarrhea, and deafness. Vitamin E may promote normal reproduction and helps in the formation of muscle and red blood cells. You can find vitamin E in leafy green vegetables, wheat germ, and margarine. Indications of deficiency of vitamin E: in diseases like or in symptoms like edema, ataxia, and absence or reflexes. If you have an excess of vitamin E, you can have a patient presenting not definitely known the cause in vitamin E, but large dose may destroy vitamin K in the intestine. Large amount of vitamin E can destroy vitamin K in the intestine. Now, vitamin K is essential in the formation of prothrombin in the liver, which is necessary for normal blood clotting. The food sources of vitamin K are dairy products, leafy green vegetables, cauliflower, soybeans, liver peas, potatoes, and tomatoes. An indication of deficiency of vitamin K is because of poor blood clotting, even hemorrhage. Vitamin C. Vitamin C is important for maintenance of bones, teeth, and small blood vessels, prevent scurvy, and promotes healing of wounds and formation of protein collagen. Aids in the absorption of calcium, may help in preventing the common cold. Food sources of vitamin C are citrus fruits, tomatoes, melons, fresh berries, raw vegetables, and sweet potatoes. Indications of deficiency of vitamin C are fatigue, irritability, fleeting joint pain, tendency to bruise, and a small petechia on their tongue. Now, vitamin B, that is a large group. Vitamin B1 is essential for the release of energy from carbohydrates and nerve conduction. Vitamin B1 can be found in food sources like yeast, wheat germ, lean meats, pork, dry beans and peas, dairy products, poultry, eggs, dark green vegetables, and whole grain enriched foods. Indications of deficiency of vitamin B1 are beriberi, the disease beriberi, malaise, polyneuritis, and numbness and tingling in the extremities. The vitamin B2. The B2 is essential for cellular oxidation and the storage of energy, help maintain the skin and mucous membranes. Food sources of vitamin B2 are organ meats, lean meats, milk, green vegetables, eggs, poultry, and yeast. Indications of deficiency of vitamin B2 are skin and lip lesions, seborrheic dermatitis, inflamed tongue, lack of vigor, and ocular changes. Another type of B vitamin, that is the niacin, is part of the group of B vitamin. Niacin is important for cellular respiration, glycolysis, and lipid synthesis. Food sources are liver, lean meats, and fish. Indications of deficiency are pellagra, dermatitis, irritability, dizziness, and skin and mucous membrane lesions. Now let's mention vitamin B5 that aids in the metabolism of foods. You can find it in whole and enriched grain products. B6, vitamin B6 is necessary for the metabolism of amino acids and fatty acids. You can find it in muscle meats, liver, and yeast. And the indications of deficiency are because of skin lesions and anemia. Vitamin B12 is vital for the production of red blood cells and genetic material. You can find it in liver, kidney, milk, fish, and muscle meats. Folic acid, that is another vitamin outside of the group of vitamin B. Now, folic acid is necessary for the synthesis of amino acids, DNA, and formation of red blood cells. You can find folic acid in liver, yeast, green leafy vegetables, and the indications of deficiency of folic acid is because of fatigue, sore tongue, low red blood cell count, and macrocytic anemia. Biotin is a vitamin that regulates amino acid and fatty acid metabolism. You can find it in liver, kidney, egg yolk, and yeast. It's indicated for dermatitis, glossitis, anorexia, and muscle pain. Now let's talk about some minerals and their function, the food sources, and the indication because of deficiency, and also toxicity. Let's start talking about sodium. Sodium is the chief cation in the extracellular fluid, important for maintaining acid-base balance, regulating osmotic pressure in cells and body fluids, controlling fluid volume in the body. Helps maintain normal heart action, regulating muscle and nerve irritability. Food sources of sodium are meat, sardines, cheese, green olives, table salt, baking soda, baking powder, milk, eggs, beets, spinach. Indications of deficiency of sodium are because of hyponatremia, loss of weight, weakness, cramps, salt hunger, and nervous disorder. The toxicity or the excess of sodium can cause hypernatremia, confusion, and coma. Now let's talk about potassium, the mineral potassium. Potassium is the chief cation in the intracellular fluid. We said that sodium was the chief cation in the extracellular fluid. So potassium is the chief cation in the intracellular fluid and helps maintain the acid-base balance equal than the sodium. It's important in nerve impulse conduction and muscle tissue excitability. The food sources for potassium are cereals, dried peas and beans, fresh vegetables, fresh or dry fruits, especially bananas, prunes, and raisins, sunflower seeds, nuts, meats, molasses, oranges, and orange juice. The indications of the deficiency of potassium are hypokalemia, muscle weakness, thirst, dizziness, mental confusion, and arrhythmias. The toxicity of potassium and excess of this vitamin, of this mineral, is hyperkalemia, confusion, and even coma. If a person is injected potassium in a very large amount directly through the veins, it can cause coma and death. So potassium is kind of dangerous as a mineral and as a medication. It's very delicate, the use of potassium. Calcium plays a key role in the blood clotting and lactation, helps in maintaining acid-base balance too, activate enzymes. Calcium need for proper functioning of the nerves and muscles, maintain cell membrane permeability, in combination with phosphorus help form strong bones and teeth. The food sources for calcium are dairy products, beans, cauliflower, egg yolk, molasses, leafy green vegetables, tofu, sardines, clams, and oysters. The indications of deficiency of calcium are because of hypocalcemia, brittle bones, poor development of bones and teeth, rickets, tetany, excessive bleeding, and irritability. An excess or a toxicity of calcium can cause hypercalcemia, gastrointestinal atony, renal stones or failure, psychosis, drowsiness, and lethargy. Let's talk about magnesium now. Magnesium is important in maintaining muscle and nerve irritability, help regulate body temperature, and aids in bone and tooth development, activate certain enzymes. You can find magnesium in widely distributed in foods, especially whole grains, fruit, meats, nuts, vegetables, seafoods, and meat. Indications of deficiency of magnesium is because of hypomagnesemia, tetany, muscle tremor, and weakness, mental confusion, depression, and ataxia. The other minerals, I'm going to let you read about them: phosphorus, iron, iodine, copper, zinc. Now let's talk about herbals and supplements. DSHEA of 1994 defines dietary supplements. These supplements are available over the counter, are not tested by the FDA for safety and effectiveness, are the more natural way of treating diseases. Always tell your healthcare provider about any herbs or supplements you are taking because of any medication interaction. May interact with certain medications. Under the Dietary Supplement Health and Education Act 1994 DSHEA, Congress defined the term dietary supplement as a product taken by mouth that contains a dietary ingredient intended to supplement the diet. Let's mention some of these herbals. Maybe you're familiar with some of them. Echinacea, that stimulate the immune system. Feverfew, for prophylaxis of migraines. Garlic, that is an antiplatelet antibacterial, antifungal, antihypertensive, antihyperlipidemic, and anti-inflammatory properties, stimulate the immune system. So garlic helps for everything. Ginkgo or ginkgo biloba increase the blood flow, improve memory, relieve depression, anxiety, dizziness, headaches. Ginseng is a herbal that increases endurance and stamina, strengthen mental performance, and boost immune system. Golden seal treat infections of the mouth. Kava reduce anxiety. Melatonin improve sleep. St. John's wort reduce anxiety and depression. So palmito treat benign prostatic hyperplasia, and valerian reduces restlessness and nervous disturbances of sleep, anxiety, and gastrointestinal spasm. So guys, this is everything about chapter 18, vitamins, minerals, and herbals. Let's join the Zoom meeting back again to continue with chapter unit 19, that is about psychotropic agents. Please join back the Zoom meeting right away.